Good morning, this is Dr. Hansen. Today we're going to be talking about Sculptra. Sculptra is a biostimulant. It is not a filler. There are other fillers such as polymethyl methacrylate. Then there's also calcium hydroxylapatate, hyaluronic acid, and those are actually fillers. So what they do is they go in and you kind of see what you get right away. But this one actually stimulates the body to produce collagen. We can be using it in different spaces. It can be used in off-label spaces, such as sometimes we'll use it in the chest, even a little bit above the knees. Some people are even using it for Brazilian butt lift, but it takes a lot of the product to do that. We primarily are using it mostly to kind of fill in the buccal fat area through here, or even in the preauricular area back in here. Sculptra comes in vials that are kind of a powder, as you can see here, and what we do is we dilute it down, and we dilute it differently depending on the area of the body that we want to inject. Some areas we use more concentrated, and some areas we want it to dilute out. Now, one of the advantages also to Sculptra is Sculptra can affect the skin, and it can actually help the skin look better over time. And in just a diluted version of it can actually help the skin of the face to just look more youthful, and believe it or not, and that's without using any lasers, of course, which we have lots of. But if you would like to, you can set up an appointment. We can talk about that in different spaces that we can use Sculptra in. Again, it can be used in multiple places. It can be used in the face. It can be used, believe it or not, in the neck, the chest, and the bottom, even the knees, that crepiness on your knees that a lot of people will get as they get a little bit older and with sun damage. So those are some of the great places to use Sculptra. You can go ahead and contact the front desk, and we can get you set up to come in for a consultation to discuss Sculptra in further detail.